distracting. I like to kind of speak to the audience. And so if you wouldn't mind sharing, if you feel comfortable, if you wouldn't mind putting like where you're located at or your discipline. I'd really like to learn the discipline of the folks in here today. If you are prescribers, if you're therapists, what your discipline is. If you don't mind sharing that in the chat. Now, there are 3 different chat options. Okay, I'll go ahead and start out. We have the public chat option. We have, and that's everyone will see your comment. Okay, everyone will see your comment. But we also have the private chat option as well. And so if there's something that you question you want to ask, but you don't want to put in public chat, feel free to slip it right into private chat. And then also, we have the Q&A. Now, the Q&A I don't see as well. I actually have to go over to that tab, so I don't like see it immediately. So please feel free, to skip that area if you want, and put it in private or public. So, well, fantastic. We've got a lot of wonderful people on the webinar today. Henry, welcome. Christina, Maureen, Nicole, Dylan, Johnny, Maureen, Johnson City, Tennessee. That's not far from me. I'm located in Charlotte, North Carolina. So it's fantastic to have you. We have psychiatrists in here, pharmacists, EMS providers, nurse practitioners. So fantastic to have you in here today. So absolute pleasure. Well, I am going to go ahead and get started straight into the webinar. If you have any questions at all, please do not hesitate to put them in the chat. Marcel, Julian, Vanessa, Mary, Mark, thank you so much for joining. That's fantastic to have you in here. Vanessa, I'm slightly jealous of your location. You're in the Bahamas. That sounds absolutely amazing right now. Charlotte is trying to be warm. It's not warm there yet. But it is fantastic to have everyone in here. Like I said, lots of different disciplines in here today. So this is absolutely wonderful. What we're going to do today is, and a lot of you are your mental health professionals, a lot of you in here, or your healthcare professionals. And really, it's essential to acknowledge that a lot of our patients face challenges in finding the right psychotropic medication. And it can be really disheartening, especially when the initial prescription, it doesn't yield the desired results. And that can exacerbate an already difficult situation that your patients that are experiencing mental health issues are facing. And then when you throw on top of it those unpleasant side effects, that just compounds the distress. Now, I have a lot of people asking in the chat, in the private, so I'll go ahead and address that right now. We do have handouts in here. My slides are going to be there for you, so feel free to download those. There is some information in there that I'm going to be presenting that is not in the slides, and that is because it's just sensitive information, so we didn't put that in the slide deck. And right now, Jan, are recording, right? We are recording this webinar. So you will get the recorded version. So if any reason you have to drop off, something comes up, that's not a problem. We will send you that recorded version. And any webinar you sign up with Iconus will send you the recorded version. So no worries about that. All right. Okay. So when we're talking about genetic factors, those all significantly contribute to variability in an individual's response to prescribed medications like an SSRI or mood stabilizer. And while one person's going to find relief from a particular drug, another patient may experience adverse effects without any kind of symptom improvement. So understanding these kind of genetic nuances really underscores the importance of personalized medicine approaches. And pharmacogenic testing really offers a promising avenue to tailor medication to selection and individual genetic profiles, and potentially can minimize the trial and error process. And there's a lot of research in the realm of major depressive disorder and guided prescriptions that can enhance treatment outcomes and symptom remission and response. But it's crucial to approach this area with caution, and there's going to be several factors. And we're going to talk about that today because we've kind of done our own little independent study. But studies can be susceptible to bias, and reported outcomes may not always be transparent. And then you have the degree of certainty regarding the pharmacogenic test. And we're going to talk about that today. We're going to talk about like what the APA says, what the FDA says regarding it. We're going to go over cost and pricing of different companies that offer this, And we also have a case study in which we compare two tests that were done on the same individual. So a lot of things in the webinar today that I hope will be really helpful for you as you're moving forward in your practice. To let you know that we did test the two companies and we did find differences. And I want to be really transparent and discuss those. So, and we'll be going over a lot of different research studies as well. But this is understanding the pharmacogenics. This is really the there are a lot of variable in drug responses among individuals. And what proves to work for you may not work for me, right? There may be unexpected outcomes, undesirable side effects, and that response stems from multifaceted factors like age, your physical constitution, your overall health status, any potential interactions with concurrent medications. And that's a pivotal determinant of influencing individual drug responses, really lies within the realm of genetics and can be explained by the field of pharmacogenetics. And there's there's an illustrative instance of genetic interplay, and I think that's example by cytochrome or CYP2D6 gene, and that gene encodes a really crucial protein for metabolizing various medications. And that particular one orchestrates the conversion of codeine into morphine. Um, if you don't know what codeine or morphine is, they're pain relieving, potent pain relieving compounds. But certain individuals harbor genetic variants in those, and that results into altered metabolic activity. And individuals classified as poor metabolizers really exhibit diminished enzymatic activity, and that impedes the efficient conversion of codeine to morphine. And that, unfortunately, that analgesic efficiency of codeine can be diminished in that population of individuals. So, but on the other hand, there are individuals categorized as rapid or ultra rapid metabolizers, and they demonstrate heightened enzymatic activity leading to accelerated conversion of codeine into morphine. And this acceleration really it predisposes them to an accumulation of excessive morphine levels and the heightens the level of adverse effects. Okay. So this overarching goal of pharmacogenetics is really to delineate individuals' metabolic profiles for specific medication. And once you were armed with this genetic insight, then you as healthcare practitioners can tailor medication prescriptions and optimize the therapeutic um, levels for them while mitigating the need for ongoing trial and error adjustments. And so, and you see this a lot in the field of mental health because, again, unfortunately, individuals don't always respond to that first antidepressant or antipsychotic medication that they're prescribed. And this is frustrating. It's not only frustrating for the patient, but it's frustrating for you as the prescriber or the person giving the medication as well, or if you're their therapist. So you see this a lot. So the integration of pharmacogenetic data is perpetually relevant throughout the individual's lifespan. And with each new medication requirement, clinicians can reference that individual's genetic predispositions to hopefully anticipate potential or adverse reactions and foster personalized and precise therapeutic interventions on those. Now, I can go now there's some pharmacists in here I saw, and I also see names popping up that I know in the field that are scientists as well. So it is a pleasure to have everyone in here today, and I thank you so much. I There are people in this webinar right now that could explain the difference between these three, the pharmacokinetics, the pharmacodynamic, and the epigenetic factors. So I'm going to do my best job in explaining these. Pharmacokinetics is really in the context of genetic testing for mental health medications really pertains about like how your genes influence the absorption, the distribution, the metabolism, and the excretion of those medications within the body. That's pharmacokinetics. And genetic variations can significantly impact pharmacokinetics and mental health medications. Like, for instance, certain genes just encode enzymes responsible, they may encode those enzymes responsible for metabolizing those drugs. And variation in these genes can lead to differences in the rate at which medications are broken down or eliminated from body. And that can affect the medications response, as well as the risk of adverse reactions. Now, pharmacodynamics is really within the context of genetic testing for mental health medications, refers to how an individual's genetic makeup influences the body's response to these medications at the molecular level. And then you have epigenetic factors, which are a little bit different. And look, I could go on and talk about this slide for 35 to 40 minutes, but I want to keep it really brief. Epigenetic factors within the context of genetic testing for mental health medications refer to modifications to the structure of the DNA that influence gene expression without altering the underlying genetic code. And these modifications can occur in response to various environmental factors that could be stress, diet, lifestyle, medication exposure. And epigenetics really explains why you can have two identical twins that originate from the same DNA, but they turn out so different, even when the traits they have a significant genetic component. Now, and epigenetic modifications can really affect how genes related to mental health medications response are expressed. And again, this is all about influencing or how the individual's response to treatment is. Now, I'm going to give kind of a metaphor for this and explaining these three terms, and then I'm going to be done. Okay, with this, because I don't want to get too much in the weeds. I want to hit the surface of basically what these tests are really good for, what different organizations say about them, what the research says about them, and then reveal kind of our case study that we did in these testing, which was different than what we had expected. But pharmacokinetics, if you think about a river, right? If you imagine in your mind a river, and if you know through my history, for you guys that know me that are in this webinar, I am an avid kayaker. And I love riverboarding. I was on the U.S. team back in 2015, so that's been a long time ago. But I love rivers, so I'm just going to use kind of the metaphor as a river. So if you imagine a river and it's flowing kind of through the landscape, and I want you to think about that as a journey of medication through the body. Pharmacokinetics is kind of like the path the river takes. Um, and rivers, the most of the sources are from ocean, so it's kind of that path that it takes from the ocean. And the river in pharmacokinetics, think about it this way: rivers encounter obstacles. They got currents, they have trees all along the course, and medications encounter various processes in the body that affect their absorption, that affect their distribution, that affect their metabolism and their excretion. So factors like, if you think of the speed of the river, that could be the metabolism. If you think about the size of the river, that could be the distribution. And then all the obstacles it faces, that could be the excretion. And all of those influence how effectively the river or the medication reaches its destination. With pharmacodynamics, it's it's like the impact of the river that it has on the surrounding landscape. So as the river flows, it erodes rocks, it shapes the valleys, it nourishes all the vegetation around the river. And that's similar to medications, how they interact with specific targets in the body, like receptors or enzymes, they to produce those therapeutic effects. And just as different rivers can kind of sculpt these unique landscapes, different medications can elicit distinct physiological responses based on their interactions with their molecular targets. And then for epigenetic factors, the epigenetic factors, those are like, if you think about weather patterns and environmental conditions that all influence the river's behavior over time. You've got rainfall and temperature changes and human activities that can alter the river's flow, right? And it affects its course and its impact on the landscape. Well, that's the same with epigenetic factors. And so they can modify the gene expression patterns in response to that environmental stimuli. And these changes can really influence how medications interact with the body and may impact treatment outcomes over time. So, again, pharmacokinetics represents the journey of the medication through the body, um, and the pharmacodynamics really symbolize its impact on the physiological targets, and the epigenetic factors really reflect the environmental influences that shape the medication response. So just understanding the landscape and the weather patterns can really predict the behavior of a river, like considering pharmacokinetics, pharmacodynamics, and epigenetic factors can really provide insights on how medications interact with the body, and you can tailor treatment approaches for the individual patients. I hope that was helpful. The river, again, this one slide you could talk about for probably actually over an hour, but I hope that the river analogy kind of helped a little bit with the understanding of these. Now, I'm going to get out of the really kind of scientific things going on and really talk about improving medication selection for psychiatric disorders. Now, I do have some polls up, and I'd like to get some feedback from you. Now, we have some poll questions, and I'd like, Janet, if you could push one of those, the first poll question out. I'd love to get some feedback on that. And one of the things is when we give you the polls, we will give you the results at the end of the polls as well. So we'll start pushing those poll questions out. And Janet, just give me a thumbs up if that's coming through for people. But here we want to talk about how mental health professionals can kind of include genetic testing in their treatment plans. And that's one in your assessment evaluation. So, before you even consider genetic testing, you want to conduct a thorough assessment of the patient's medical and psychiatric history. And, oh, you know what? That's cute. It's wanting me to do the poll too. That's fine. I will do it later. How about that? All right. It gave me a pop-up like, do this poll. I'm like, okay, all right. So first you want the assessment and evaluation, and you want to look at things like their current symptoms, their treatment response, what's their family history been, and other relevant factors, and then identify specific treatment choices, like where genetic testing could provide you valuable information. If the patient comes to you and says, I've been on Prozac for 40 years, I'm not going to change that. Would you order genetic testing? Right. Risk assessments are really important as well, but also informed consent. One of the things on informed consent is you want to discuss like the purpose and the benefits and the limitations and any potential risk of genetic testing, which is low, okay, low, mild, almost non-existent with genetic testing, but you've got to obtain the informed consent, because you've got to make sure that the patient understands the implementations or any issues that can arise from genetic testing, and has the opportunity to ask questions and express concerns. And then it's about looking at the right test. You definitely want to choose a reputable genetic testing provider. And there have been some out there that have not been. And so you want to make sure that you choose one that has a good reputation, and think about your treatment goals in there when you're selecting the appropriate test. Okay. And then when you uh, get the results, you want to interpret those results, and the clinical context of the patients. Their clinical presentation is going to be key in what you're doing with the treatment plan. So, and if you feel like maybe the results are not correct, you're going to consider a genetic specialist. Okay. So that's one of the things that, and with genetic testing, I think it's important to use the results to inform treatment decisions. And you really want to go at the genetic test with looking at it as a minimal, what's the risk of adverse effects based on the patient's genetic profile. All right. Now we're going to talk about some research studies, and I'm going to go through these kind of quickly. Okay, fantastic. So polls are pushed out. Great. Thank you so much, Jana. Thank you. Thank you. These are some research studies on genetics itself that I think are good to highlight. On the first one, this study really examined the genetic basis by analyzing data from a genome-wide association studies, and those they found there were common genetic variants associated with schizophrenia that tend to be located in genes that are intolerant to mutations. So, and that really suggests that schizophrenia may arise from a combination of rare and common, both genetic variations. So that was, I think, a really interesting study. The first study, uh, Ray did a second study on identifying genetic variants associated with major depression. That's study number 2. And by analyzing data from, it was over 135,000 individuals with depression. And in the controls, there was over more than 344,000. And that study identified 44 genetic risk variants for depression. Now, Howard did a study as well that identified 102 independent genetic variants linked to depression, and it really highlighted the importance of genes expressed in the prefrontal brain regions. And understanding that genetic basis of depression in a specified brain region, I think, could really help lead to targeted interventions for individuals with depression. So, and the study, the the fourth study was really aimed to dissect the genetic overlap between bipolar disorder and schizophrenia. And by analyzing genetic data from large cohorts of individuals with bipolar disorder and schizophrenia and controls, the researchers identified specific genetic variants associated with each disorder. So I think all these studies are really, really important and highlighted specific aspects of the study of genetics and with mental health. Right. Now, the next set of studies that we're going to talk about, I like to pull at least 25 to 30 studies and pull the top 5 that I think are important. And the first study, I think this one was really important because it connected a wide array of things going on. And the genome-wide association analysis, it helped identify genetic variants associated with response to serotonin, the SNRI antidepressants in individuals with major depressive disorder. And the research has identified several genetic markers associated with treatment response in that. Now, Winter did a study on using genetic testing to guide medication selection. And this study, now this is an older study. It's done in 2013. I usually don't like to pull in studies if they're if they're more than 10 years old. But this study did is it showed that using genetic testing to guide medication selection resulted in a reduced overall pharmacy costs in a 1-year period. So that suggested potential cost savings and improved outcomes with that personalized kind of medication selection. Hall and Flavin, these researchers found that incorporating genetic testing into treatment decisions led to improved medication selection and dosing, as well as a greater treatment adherence and patient satisfaction. Um, so that was really good. Let me pop back, sorry. Uh, and I think that I'm going to talk about Sing. This was not a single study, again, older study, but this reviewed a comprehensive overview of the pharmacogenetic studies investigating antidepressant responses. So, and all these studies just highlighted the importance of a continued research in this area for personalized treatment approaches. Now, we're going to go over some things. I always refer to Dr. James Kennedy because he spoke about advancements in laboratory technology, and basically technology within the past decade has significantly transformed genetic testing processes. So there 10 years ago, pharmacogenetics was primarily a research endeavor. There were limited clinical applications, and so it was kind of genetic testing for medication response was kind of in its infancy. However, in the recent years, there's been a remarkable acceleration with modern machines capable of analyzing DNA at a much faster pace. And they can get this back to the physicians as early as like the second business day following that collection of a saliva sample for the patient. That is the most for folks out there to like, well, how do these tests even done? Saliva sample is the most common. But again, these tests have become remarkably streamlined, and basically patients fill out a form, they complete a saliva test within minutes, they seal a sample tube in for transportation to the lab, and then that genetic testing expedites the analysis over just a few hours. So that's one of the really wonderful things about this. It's much more accessible now, it's much more affordable, and that allows for widespread adoption in clinical settings. However, I do want to talk about the American Psychiatric Association in 2018. It published some criticism of genomic testing and emphasized their kind of skepticism. I don't want to say towards psychiatrists, but it was saying towards folks that are using this genetic testing to make informed decision about diagnosis and treatment. And basically an abstract of their statement read, evidence does not support commercial rush of DNA tests designed to inform decisions regarding patients' psychiatric medications. So now the APA has since provided some guidance and perspectives on use of genetic testing related to mental health concerns, and I think there's some key points. The APA brings out, look, genetic testing, it's an emerging field, but it cautions that most mental illnesses involve multiple genes as well as environmental factors, making genetic testing complex. Now, the APA it supports research in genetic testing and neurobiological factors contributing to mental disorders, but it emphasizes that genetic tests for mental illness have limited clinical applications currently and should not be used alone for diagnosis or treatment planning without considering other factors. So that is, again, and it talks about throughout in their recommendations to ensure proper understanding of clinicians as to the results and as to their limitations. And the APA the APA has expressed some concerns about potential misuse or interpretation of that genetic data and discrimination based on that. Now, there are laws out there on genetic testing, and they're pretty strict guidelines. So I do want to go over that. But overall, the APA's views on genetic testing as a potentially useful tool when combined with other clinical information, but it really urges caution about over relying on the genetic data alone for mental health assessment or treatment decisions. So I really want to be forthcoming because I think agencies like the APA, well-respected organization, their feelings and thoughts on that really needs to be considered in your clinical decisions, right? And education. Now, I do want to talk about some of the genetic testing, the places and the prices, and all of these. The companies and tested that are listed above are related to genetic testing, and this is these are some of their prices, and these are estimated prices. Now, a lot of the genetic testing has to be ordered by prescribers only, okay, by prescribers only. However, the test that we have in blue, the Clarity X and number 7, can be ordered by patients. Okay, they can be ordered by patients. So, and GeneSight actually has a calculator on their website that gives you kind of like your estimated cost. Now, Myriad Genetics, which is Assurance Health, and I apologize, these are not numbered correctly. I'm so sorry. But they basically, and that I think that happened when I pulled it from a Google slide to a PowerPoint, so I apologize. Myriad Genetics says that 95% of private insurances have coverage for their genetic testing. 90% of customers have no out-of-pocket costs. And for those that do, it's $54 is the average out-of-pocket costs. So if you're thinking, well, if my patient has insurance, what is the amount that they're going to pay? That according to Myriad Genetics, that is going to be their cost. We put Clarity X on there because that's one of the tests that we used, and that's on sale right now for $299. As Iconotes, we don't align with any of these testing sites. I do need you to know that there's not one that we think is better or worse, and we're definitely not aligned with any of the testing sites. Interestingly enough, I did reach out to several of these to see if they wanted to speak at the webinar today, and they did not. So I found that really interesting. So, but these are some of, and you can definitely take this if you're thinking about having genetic testing. Again, if it's in blue, it can be ordered by the patient and done by the patient from their home. But the other ones, the that are in black, are by prescribers. So I just want to let you know about that. All right. Is this information helpful as far as the testing places and prices? Is this something we wanted to put together a list? There are more out there, but we tried to put together a list of the ones that are more reputable. So definitely the ones that are a little bit more reputable. All right, thank you. Thank you so much, Susanna. And Dawn, thank you. Thank you very much. I appreciate you. Marina, Tracy, very thank you, thank you. All right. Well, I'm going to go ahead and jump into our case study because I think you're going to find that very interesting. And we actually kind of planned the whole webinar around this particular case study. It's a little eye-opening, and I'd love to get your feedback on this as well. So thank you guys so much in the chat. I really, really appreciate you. This is the case study. So this is our patient started experiencing severe anxiety at the age of 3. At the age of 7, she was initially prescribed Zoloft, which resulted in stomach aches. Those are kind of those unexpected results, right? Their side effects. And next, she was prescribed Prozac, which was life-changing, and that medication worked until she was 15 and experienced a traumatic assault. And during that time, she was prescribed Effexor and Pristiq, which caused side effects, and Abilify gave her heart palpitations, and Seroquel made her too drowsy. Another provider recommended genetic testing. And that resulted in a prescription for Lamictal, which stabilized her at age 19. And then she went into a PHP program and was diagnosed as bipolar type 2. And the patient was then diagnosed with ovarian cancer, and she underwent surgery and chemotherapy. And then she was added an additional medication, and she stabilized. Many times in case studies, they were written by clinicians. Because of the sensitive nature of this one, we actually let the patient and the patient's the mother participated in this, which was I think it was kind of it gave a little feel to their own story. In case you were wondering, this patient not only has survived ovarian cancer, but has thrived, and that is a really, really wonderful thing. But so this particular patient took 2 tests, one from Clarity RX, which was the at home, right? The one on sale that we showed you, and then one from GeneSight. And those results were different. And we're going to talk about that, and we're going to really highlight that. So we have Celexa here. And I'm going to break it down by medication. But Celexa, GeneSight said to use it with caution, and Clarity X said to consider alternatives due to significant gene-drug interactions. And that's generally, if you're wondering, that's usually how the test comes out. They usually have 3 kind of columns. One is it's fine to use, one is has moderate gene drug reaction, and then the third column is significant gene drug interactions. So kind of the do not use. And this is explained to clinicians. When you get the testing for your patients, you're going to see that in kind of red and green and yellow spikes. Is generally the way the clinical presentation for these tests are. It varies with each test, of course, but that is generally they'll put like red and green and yellow. So and so you have these 3 categories. But again, GeneSight said use it with caution. Clarity X said like consider alternatives. Okay, so that was one. We're going to go, and that's Celexa. We're going to go to the next one is Paxil. With this particular patient, it said Clarity X said to use it with caution, and GeneSight said to consider alternatives due to significant gene drug interactions. So it's flipped. So before it was a GeneSight saying, moderate, and Clarity X saying significant. Here it's flipped with this particular medication. And then we'll move on to Lexapro. So so far it's Celexa, Paxil, Lexapro. Lexapro, GeneSight said to use with caution, and Clarity X said to consider alternatives. It was significant gene drug interactions. And there were differences throughout the testing. And it wasn't just on these 3 drugs, and I'll go into further details here. This is kind of just an Excel where it shows the differences, and this was the results by Clarity X. You can see the medication is on the first column. The results by Clarity X are saying, like, use it as directed, and then the Clarity X is saying, use it as directed, and GeneSight is saying, use it with caution. So definitely a difference there. And again, this is Clarity X to GeneSight, but then when we move to the next slide, we're going to see there is medication like this. We see the Wellbutrin, Buspar, Trintellix, all of that. And then results by Clarity X say use with caution, while GeneSight says just use as standard. It's fine, use as directed, standard precautions, where Clarity X is saying, hey, these you got to use with caution. So as we flip back on those 2 slides, there are a lot of people in here tonight, and I see you and where you're from, and there are a lot of really, really intelligent people in here today. And so I'd like to get your thoughts or feelings on this. Suzanne said, getting mixed results can be an issue. Absolutely. Absolutely it can. Because if I'm looking at this to treat my patients, this is kind of, it's throwing false flags a little bit. Absolutely. And so again, this same person, I want you to realize, same person, different test, different results. No, I don't know. I haven't seen, when we went to create this webinar, we hadn't seen anything out there that showed the difference between, like, same person, 2 different tests, what would the results be? And we didn't really know. And honestly, when we started to do this webinar, and we went to get the second test, I thought, you know what? I think the results are going to be the same. And boy, was I wrong. Boy, was I wrong. So Maureen said, I wouldn't want to spend money on that as a consumer. I definitely hear that. I understand that. Absolutely. Dawn said, the color coding of green, yellow, and red, red being the worst to try and explain that to patient makes it more complicated than necessary, it seems. I can definitely, I hear that. I hear that. So Suzanne had an excellent point. This is probably why the APA isn't 100% supporting this yet. Exactly. Jesse says, mixed results, especially with the potential high out of pocket cost, doesn't seem great. It doesn't seem great, does it, Jesse? Absolutely. Christopher said, review the interaction as it may be something to consider lower doses or higher doses, which isn't true contraindication to the medication. That's an excellent point, Christopher, is an excellent point. One of the things, though, and especially why I'm kind of focusing more on Clarity X than GeneSight, is because GeneSight is not one of the ones that a patient can just order by themselves, right? So, but Clarity X is. Now, and it seemed like, to me, it felt like Clarity X actually was a little bit more cautious than GeneSight. I don't know. The results, again, you can see the results for yourself. We've posted them right here for you to see. But I felt like that Clarity X was kind of leaned on the side of caution. That is my opinion. Okay, that is my opinion. So Marina said, as a parent, that would make me nervous. You were hoping for more clear. I was hoping for more clear results as well. Absolutely. I thought 2 tests will go out. We want to make sure it's totally different companies, different ways of ordering the test was important to us. But I felt for certain the results would be the same, and they're not. Nixon says, priority is on the traditional objective and subjective assessment of the patient, including medication rollouts. I think you just hit it on the head. Absolutely. And that's what the APA is saying. The APA is saying that as well. You've got to look at the clinical. So and Amy, I think you brought up something. And you absolutely hit the nail on the head. The guidelines published by the FDA, the CPIC guidelines, and the Dutch Working Group can all be slightly different and summarized differently. You're absolutely right. You're absolutely right. So, but it is concerning. It's definitely concerning. And so we thought this information was really pertinent. And so Um, Now, I'm going to talk a little bit more about when we talk about limitation. And Amy, I'm glad you brought that up because when we talk about limitations and considerations of genetic testing, incomplete understanding is a problem, genetic complexity, and there's definitely ethical considerations. But I want to talk about the U.S. Food and Drug Administration. Within the past several years, they have intensified the regulatory actions against labs offering these pharmacogenetic services without pre-market clearance or approval. And that move that they made really aimed to encourage more firms to submit their tests for regulatory review. And so many labs are now only reporting the PGX variants detected in patients, and they're kind of removing any mention of drugs from their marketing materials or the lab reports because they're trying to comply with the FDA directives. And like I said earlier, there are a few companies that are not around anymore. Now, I like to give both perspectives, right? I give you information and you make your own decisions. So the FDA has requested that certain population health studies, like NIH's, they have a program called All of Us Research Program. They only report genetic markers that are in FDA approved drug labeling. And that regulatory push has really raised some big concerns within the industry, with some fearing it's going to ultimately hinder innovation and patients' access to the testing. That's some of the concerns. And look, there are companies like Myriad Genetics and Genomind. And again, we have no affiliation with any of those companies. So I'm talking about them freely from my perspective and from information I have gathered. But the Myriad Genetics and Genomind, they've interacted with the FDA regarding their PGX offerings. And Myriad Genetics kind of disagreed with some of the FDA's requested changes, where Genomind has complied with the FDA's directive to stop mentioning drugs associated with genetic variants in their reports. But I will talk about industry insiders and what I've read. They criticize the FDA's tactics. They kind of feel like the agency is overreaching in its attempt to regulate testing, and they argue that the FDA's kind of insistence on regulating scientific knowledge and clinical practice could stifle progress in personalized medicine. And I hear that argument. But I also hear that the FDA has to intervene. So, but despite any challenges, there's growing acceptance of these testing. And let me tell you why I think there's growing acceptance, because you've got companies like United Healthcare who they decided to extend coverage for these panels. And there there is uncertainty about how the FDA is going to regulate the field and what source of evidence it's going to accept beyond the drug labeling. But I think what I do feel strongly is that overall stakeholders in the industry are going to work together to kind of navigate these regulatory complexities and ensure patient access to the PGX testing. But it is a little concerning, right? It is a little concerning. They should be like, I feel like the test should be the same. So Amy brought up a good point. You look at each of these resources, compare their lenient versus aggressive stance. Exactly. Farmkgb.org is GKB, sorry, KGB. I'm not sure where that came from. So, so is an excellent resource and has reviews of each of these groups and literatures. Fantastic. Thank you so much for sharing that resource. Thank you so much. So excellent. Well, I I really wanted to talk about conclusions and kind of the takeaways here. I think the genetic testing as it progresses and this is my opinion, is going to be a powerful tool, okay, to tailor medication selection and dosing. But and you can incorporate genetic information into treatment planning, and clinicians can kind of move towards a more patient-centered approach that considers these biological factors with a medication response. But I also think, and what's really important, because we have a wonderful group of people in here today, it's going to take more collaboration between psychiatrists, geneticists, pharmacists, and other healthcare professionals to ensure that you get comprehensive and effective utilization of these genetic insights into clinical practice. And I think by working together, we can all leverage the full potential of genetic testing to optimize medication management and really just enhance patient care. So, um, I have another study that I want to share. I love studies, and I apologize. I am one of those people that I love. My dream job is reviewer number 2. Okay. I even have a little cross stitch that says all things are possible by evidence based. it's I love studies, and I want to share this one. I wasn't able to incorporate it into the webinar today, but it just came out last year, and I'm going to put it in the chat, but it's basically barriers to genetic testing and clinical psychiatry and ways to overcome them. So I'm going to post this into the chat, and it's a great one. Any, so I want to go into any questions. Any questions? Amy has some really good information in here as well. She just posted. Thank you so much, Amy. You're passionate about this. I can tell, and I love it. I just want you to know. I feel your energy through the chat, and I absolutely love it. So I absolutely love it. I'm going to go to the Q&A portion. So I'm going to drop to the Q&A portion for a minute and get questions for here. So it just takes me a minute to get there. So I apologize. Please share your thoughts and feelings in the chat. I love when people share because, again, there are a lot of smart people in this room right now. Sorry, it's just taking me a minute to. This webinar is sponsored by iKnotes, so I am going, of course, I'm going to do like a little iKnotes plug at the end, but right? Marina said, absolutely, absolutely. So, absolutely. I love it. I love it in the chat. I'm just trying to, okay, so Suzanne had said, do we know yet if this is covered by insurance? It is covered by a lot of insurances. We were doing research on this, is like which companies cover it. There was a wide array of companies out there that covered it. So absolutely. Great question though, Suzanne. Great question. Amy says, as a pharmacist, do I only have access to 2 of these companies, and which insurance companies are paying? Well, now I think state laws differ, right, for pharmacists, a little bit. And listen, I'm not savvy on that as well. But are you saying, Amy, like you want to tell your people to get the test done? These are the 2 companies that they could go to. Those 2, and let me roll back through the slides because I want to show those again so you can kind of see. But on this, these are the companies. And these are the ones that can be ordered by patients. They obviously, you could recommend patients to do that as well. Listen, we are not affiliated with any of these. So I just happened to see that it was on sale for $2.99. And I thought, well, we'll throw that in there. So, but all of these are reputable companies. There are a lot more out there that are not reputable companies. So and there are a lot of companies that were in literature before that are not around anymore. It's not like they got bought out or they emerged with a different company. They're just not there anymore, which is also a little suspect, right? So I just want to go over that. Another great question in the chat. Let me just go over this really quickly. Maureen says, what protections are there in place to protect DNA? Well, there's a couple laws in place. One is, I think, the one that I think about the most. Well, of course, there's HIPAA, right? And HIPAA's not specifically focused on DNA, but it does provide um, provisions that protect your privacy and security of health information, and that will include genetic information. Okay. But GINA is the main one, and GINA stands for Genetic Information Non-Discrimination Act. And that's a federal law, and it prohibits discrimination by any kind of health insurers or employers on the basis of your genetic information. And it health insurers can't use genetic information to determine whether you're eligible or adjust premiums or prohibit employees. And it prohibits employees for using genetic information for hiring, firing, or promotion or any of those types of things. So GINA is the main one. Europe has some laws as well, kind of on the same scope. But GINA is the Genetic Information Non-Discrimination Act. So now here's the bad thing about laws. They're good. Those are pretty good now. They could change. So absolutely. Absolutely. Great questions here. Amy said, I've run into insurance only paying for 1 to 2 gene tests depending specifically on the medication the patient's taking or med that is ordered. Yeah. RX. So, and I'd like to expand my options for ordering tests for my patients. Absolutely. So you're interested in what kind of reimbursement these companies offer pharmacists in order to order these tests or counseling. That's a really good question. If you've been using RX Genomics and you feel comfortable with them, I would continue to use those if you feel comfortable with those results. That was not one that when we pulled the most, what I say, reputable ones, we did kind of a search across our clinicians as well to see what people were using, and so that's why these kind of they came up. But they are kind of limited, right? Unfortunately, and limited as far as getting the testing done. So will there be another webinar that can demonstrate how to incorporate PGX ordering into iKnotes? Absolutely, we can do that. I know we're running short on time now, but we can absolutely do that. Right now we have iKnotes Plus, and for folks that have not seen iKnotes Plus, let me stop screen sharing and then start screen sharing again. iKnotes Plus is our new platform. How many people, just out of curiosity, if you're an iKnotes customer, please type that in the chat. I'd love to. So if you're iKnotes customer, I've got some private chats that are saying yes. So in iKnotes Plus is a little different than iKnotes Classic. And so we do have lab ordering in iKnotes Plus. So it's not in the Classic program, guys. It's not in the Classic. So Carol, I know you just put it. It's not in the Classic, but it is in the Plus program. And everybody will eventually be going to what we call the Plus program. But we have our lab orders, like what's pending results and pending review, and you can order out on here as well. And the lab interface is completely easy to use. It's just it's like what lab orders do I have? You create the lab order, you select the laboratory, and you can select who you're billing there and the ordering provider and the location and the order date. And then you put your diagnosis code in here, they will populate, and then I can place the lab order. So I'm able to place it there, or I'm able to place the order and print the rec for the patient. Thank you. We like Plus too, so thank you. We love Classic as well, though, right? I've been at iKnotes for 8 years. I'm their chief clinical officer, and we both programs are great. But iKnotes Plus runs on a different new platform. And so it makes things that we weren't able to necessarily do in Classic, we are able to do on Plus. So that's one of the nice things. So I can simply just put that right in there. I can place the lab order or place the order and print requisition, and I'm done. And so ordering out is a great thing. The downsides to Plus, I don't think there really are downsides to Plus. There are a lot of features. Look, Classic has been built over the past 20 years. So a lot of features that Classic has that just haven't been built into Plus yet. And so we kind of had a roadmap of the things that are going to go into Plus. We do have billing in Plus. There are a lot of great things in Plus now, and it's getting built out new every single day. Like we have group therapies that's now going to be in Plus, that's coming out within the next few weeks, which we didn't have before. And it was only in Classic. So it just depends on the features. Now you can always talk to an account manager about switching over to Plus. No, Plus is not more expensive. That's a great question, Rita. It is the same price. It is the absolute same price. And we make your transition from Classic to Plus really easy. We just take all of your data from Classic and put it into Plus for you. So absolutely. And we are looking for folks to migrate. So Absolutely. Now I do for folks out here. Somebody said, "What is this program?" It is an EHR. We have the ability to order labs straight out, as I showed you. Um, have the ability to get reports in. We have online scheduling, so patients can online schedule onto your calendar, which is not a current classic feature. And the chart room, all of it, everything looks very similar to Plus. But one of the great things about it, if you're a therapist or a psychiatrist or nurse practitioner, you can go in and create your notes in a very simple and easy way. So I'll highlight this. You can just go into your progress notes, and it basically is like a click button system, the way that it works. Well, I just clicked out of it. I got a little too click happy, so I'm sorry. That's me. But I can go in, I can say, client has symptoms of depression, and I can talk about depression is present and maybe it's chronic and maybe they have a poor appetite and they've got crying spells. And I can talk about whether that symptom is present or maybe it's worse than it was the week before. They have sadness that continues. They have feelings of worthlessness that's present, and it creates the note for you. Of course, at any time I can type into this. Now, somebody said, "Well, how is this a little different than a AI writing your notes?" Because I know what the note is going to say, and this is written by clinicians, so you're not going to get some wonky phrase out there. And we do have a webinar coming up that shows the difference in clinical notes and AI. Look, AI it can be great sometimes, right? But it also can be really scary sometimes in the way that it writes notes. And there are lots, like there's Claude, there's Chat GPT, there's all kinds of different AI tools out there to help you, but these are pre-populated statements that are made by clinicians. So you know that you're not going to get some wonky thing in there that's going to get you in trouble. I can talk about their behavior. I can talk about side effects if I want to, or allergies. I can enter those in. I can do a mental status exam if they're doing great. I will give me a normal mental status exam. I could go in and put in rating scales. If they've completed rating scales on the portal, it'll populate into here and I can push to Icon notes. I can talk about suicide and violence risk assessment. I can justify level of care. We have EMDR. We have play therapy. And so I'm able to say if they're outpatient, it's interfering with their day-to-day activity and they require treatment. And then you can obviously enter your medications in here, change your allergies, enter diagnosis, enter service codes. Again, create lab orders to send that off, and then link your treatment plan in. So I'm able to do that. And it just makes your note taking very easy. And I can compile and preview, and then it has a note there for me. And obviously you can type into the yellow areas, but I've got a pretty note there. Looks like I spent a long time typing. So I've got some folks in there that say they want to migrate to Plus. Jenna, if you could grab these folks' name, I've got public and private. And so when we can get you right over, get you working with an account manager. Absolutely. So listen, I appreciate you guys being in here with me today. Thank you so much for attending the webinar, and thank you so much for your participation. Your questions and your feedback really are what make the webinar fantastic. So thank you so much for sharing your day today and with us. We will have more webinars coming out, and we're also going to share this data. We will probably write a blog on this data that we have as well. Dawn says, as an iConnect user for 20 years, I have never seen a better EMR. Thank you so much, Dawn. I really appreciate you. Oh, that comment disappeared. But thank you so much. You're amazing. Thank you. Thank you. All right. And Rita, we've got you. We'll take care of you. Wendy, thank you so much. Again, thank you all for your day today, spending it with us on this. And I hope this was helpful and informative. I really do. So y'all have a wonderful day. All right. Thank you so much. Y'all take care.